bile salt. Any change in the balance of these three leads to the precipitation of crystals that form into the stone. Okay? Now, भाईजान आप मुझे होस्ट तो बना दें, मुझे स्लाइडें कैसे मैं शेयर करूंगा? नेक्स्ट स्लाइड मुझे शेयर करनी है ना बेटा फुरकान। Okay. Now, what are the types of stones? Okay. The types of stones are pigment stones, cholesterol stones, and mixed stones. This is something that you have to remember. There are three types of stones: the pigment stones, the cholesterol stones, and the mixed stones. The pigment stones are the black colored stones, the mixed stones are blackish brown, and the whitish creamy colored stones are the cholesterol stones. All right, so now we are going to talk about symptoms and signs of the gallstones. The symptoms and signs, the most important symptoms of gallstone is when the patient gives you a history of abdominal pain. It is a right upper quadrant, constant pain radiating to the back. This may be associated with nausea and vomiting, and it can be associated with fever. But what differentiates a gallstone from asymptomatic to symptomatic is presence of, history of presence of pain in the right upper quadrant. Now, the pain occurs due to the stone obstructing the cystic duct, causing the gallbladder to distend. The pain resolves and the pain passes away. The pain, biliary pain, usually lasts for 1 to 6 hours. It rarely becomes for more than 24 hours. When it increases for more than 6 hours in duration, the biliary pain, biliary colic is now called acute cholecystitis. All right. Now, before we discuss the other things, let's talk about investigations. When a patient presents to you with abdominal pain in the right upper quadrant, usually in the middle-aged obese lady, the investigations you're going to do is CBC, LFT, urea creatinine electrolyte, and ultrasound. These are the basic investigations. CBC will show you leukocytosis, and LFTs may be deranged or may be absolutely normal depending on presence of a stone in CBD or not. If the stone is only in the gallbladder, then you will have a normal LFTs. However, if the stone has passed, one of the stone has passed into the CBD, which we are going to discuss later in the lecture, you might have deranged LFTs. Urine DR is done in order to rule out any urinary conditions, and ultrasound is the test of first choice. Ultrasound is done to look for gallstones. And if you look at the picture below, you will see a gallbladder with stone shadows and which are white, and you can see that there is a blackish line going from down below it, which is known as acoustic shadow. This is suggestive of gallbladder stones. Now, एक second. Now this diagram, आप लोगों को नजर आ रहा है बेटा? फरमान नजर आ रहे हैं?
Yes, sir.
Hello. Okay. You can see stones in the gallbladder, and you can also see a stone in the distal end of the CBD. This is known as cholelithiasis, when the stone passes through the cystic duct into the common bile duct and causes obstruction. When this happens, you will have associated jaundice. Fever, jaundice, and right upper quadrant pain forms what is known as cholangitis. It is a surgical emergency. Okay? The treatment for cholangitis because of a stone in the CBD is ERCP, which is known as endoscopic retrograde pancreatocholangiogram. In this, a scope is passed through the mouth, through the esophagus, through the stomach into the duodenum, and then we enter the ampulla, and you can see in the first film there is the shadow, whitish shadow in a CBD, which is at the lower end. This is the stone. And ERCP can be both diagnostic and therapeutic. Diagnostic because it can diagnose there is a stone, and it can also remove the stone by doing papillotomy and removal of the stone. So ERCP is both diagnostic and therapeutic. Now, the treatment for ये हो गई बात जो मैं आपसे कह रहा था, pain, jaundice, cholangitis, and passage of stone can also cause pancreatitis. The treatment for symptomatic gallstones is initially when the patient comes, you will treat them. If it is just a biliary pain or biliary colic, you will advise them laparoscopic cholecystectomy. Cholecystectomy is removal of the gallbladder from the patient's body. It can be done both by open method and laparoscopic method. The laparoscopic is now the gold standard of the treatment, and only when laparoscopy fails, then we do an open cholecystectomy. If the patient presents with acute cholecystitis, then it depends on the presentation of the patient. If the patient has presented within the first 48 hours, then laparoscopic cholecystectomy can still be offered. However, if the patient has presented beyond 72 hours, then you first treat patient conservatively and settle down the inflammation by keeping patient NPO and on antibiotics for at least 24 to 48 hours. And then you offer them a fat-free diet restriction for 6 weeks, let the inflammation settle, and then surgery is performed after 6 weeks. Again, the surgery is going to be laparoscopic cholecystectomy. When there is an associated stone in the gallbladder and the in the CBD, then the treatment can be ERCP with sphincterotomy in order, which is the preferred treatment. However, if ERCP fails to remove the stone, then we can perform open surgery, remove the gallbladder, and do a CBD exploration, which is known as exploration of the CBD and removal of stone, bile duct exploration, open choledochotomy. ठीक है? और ये सब आप लोगों को याद रखने की जरूरत नहीं, कोलोडेकोजुजिनोस्टोमी और ये सब, ठीक है? So the complications of gallstones, which you have to remember, includes cholangitis, gallstone pancreatitis, sepsis, and associated with sepsis, multi-organ failure. Okay? These are the complications of gallstone disease: cholangitis, pancreatitis, and multiple organ failure because of sepsis. Now, before we leave this topic of gallstone, I want to discuss one investigation which is known as MRCP and CT scan. This is important because you need to know when to do ultrasound, when to do MRCP, when to do ERCP, and when to do CT scan. Ultrasound is the first diagnostic imaging test that is done to visualize gallstones. It will show you presence of stone in the gallbladder. It may also show you thickening of the wall of the gallbladder and pericholecystic fluid. All, and along with that, Murphy's tenderness, Murphy point tenderness, ultrasonic generated, which when the patient takes a deep breath, the probe hits the gallbladder fundus and the patient winces because of pain. This is characteristic of acute cholecystitis. Ultrasound may also show you a dilated CBD with stone in the CBD. However, it is not the best modality to see it. MRCP, which is MRI, magnetic resonance cholangiopancreatography, is imaging of the entire biliary tree by a non-invasive method. ERCP was invasive because you would have to put in a scope inside a patient, through a patient's mouth into the duodenum, and then inject a dye. Images you have already seen. MRCP, on the other hand, does not require any invasion of the patient. The patient goes into a machine, MRI machine, and images are taken, and the image that is provided by an MRI is very accurate. CT scan is not the modality to see CBD stones. However, it does show you complications of gallstone, like pancreatitis, like perforation of the gallbladder. And these are the three imaging techniques that you must remember: ultrasound, MRCP, CT scan. These are radiological, along with ERCP, which is invasive. ओके, ये मैं आपको एक इमेज दिखला रहा हूं, क्या कहते हैं कि MRCP का, which you can see there is a stone in a single stone in a bile duct. There are a stone in the gallstone. You can see the common bile duct, common hepatic duct, and right and left duct, and you can also see the gallbladder. Now, on the other hand, if I show you an image of CT scan, it would look something like this. Yeah. एक सेकंड बेटा. Right, you can see this image. On top is the ultrasound, which you have already seen. There is a stone and a caustic shadowing. The down image is you can see the gallbladder, the liver, the stomach, and the pancreas. This is how the CT scan looks like. Now, in summary, gallstone disease is a very common disease. It can present as an incidental finding when ultrasound is being done for some other reason. Most of the asymptomatic gallstones do not require surgery. Symptoms of the gallstones are pain in the right upper quadrant radiating to the back. Complications of gallstone include acute cholecystitis, cholangitis, jaundice, obstructive jaundice because of stone, pancreatitis, and sepsis leading to multi-organ failure. The treatment for symptomatic gallstones is usually laparoscopic cholecystectomy, depending on when the patient has presented. If the patient has presented in the first 48 hours, then the most beneficial treatment is laparoscopic cholecystectomy. If the patient presents after 72 hours of initiation of pain, then the first line treatment is conservative medical treatment. You give them, keep them NPO, give them IV fluids, give them antibiotics and painkiller, settle the inflammation down,